what is an X-lap or an exploratory laparotomy? Well, this is old school, big surgery of the abdomen when we make a formal midline incision and we explore the entirety of the abdomen. And in our previous case, we were talking about a gunshot wound to the abdomen, so we'll keep rolling with that. So that patient was hemodynamically unstable with a positive FAST exam, and when we exposed them, they had 2 wounds here on the anterior abdominal wall and exiting, or what we thought maybe was an exiting wound at the right flank. So we are going to take them for an exploratory laparotomy. So here is your chest, your pelvis. So we're going to make just a midline incision. And what we're going to do is, in that case, most likely there's going to be bleeding. So immediately when we enter the abdomen, we're going to take what we call laparotomy sponges or lap pads, and we're going to start exploring all of the areas of the abdomen. We're going to explore the right upper quadrant, the left upper quadrant, the right lower quadrant, the left lower quadrant, the pelvis. We're going to look at the diaphragm here, okay? We're going to look at literally everything. So my big concerns for bleeding here is going to be my solid organs, so my liver over here, my spleen, okay? The pancreas sits in the retroperitoneum. I'm going to explore and run the entirety of the large and small bowel. Take a look at the stomach, okay? And then look at the pelvis and make sure that the bladder is not injured. And then look at the colon, the rectum, the whole, everything, okay? So during an exploratory laparotomy, we literally look at every single inch inside of the abdomen, and we do what we call running the bowel. That's very important, especially in a penetrating injury like this, because there could be a small bowel injury, there could be a large bowel injury, or there could be solid organ injuries like we just said. So that is what constitutes an exploratory laparotomy. And for extra credit, who can tell me what the CPT code is for an X-lap? Well, that's 49000. And for extra credit, can somebody tell me who's high level how many RVUs an exploratory laparotomy is? And that answer is 12. So that's what an exploratory laparotomy is, and that's what we do in trauma when we suspect anything going on intra-abdominally.